Hey everybody, welcome to another episode of the Hey Bellingham podcast. I'm your host, Kyle Gillette, and along with Chummy Bong, we're very excited to have you join us for today's episode. Our guest today is Dr. Caroline Hernandez. She served in the U.S. Navy and graduated from Parker University as a doctor of chiropractic. She wanted a career where she was still able to give back to her community and help change lives positively. Chiropractic care allows her the opportunity to help others with a holistic approach. At Natural Way Chiropractic, she finds the correct diagnosis, then creates a specific treatment plan for each patient. She aims to get each individual on the road to recovery quickly by healing the actual cause of the problem. So I'm really excited to have Dr. Caroline Hernandez on today's episode to learn more about the world of chiropractic care, ask a ton of questions about people's fears there, people's successes there, and also her story of her experiences going through the process of becoming a chiropractor and what her passions are as it relates to this. Plus, you're going to get some insights on her experiences in Ferndale and Bellingham and elsewhere in Whatcom County and the recommendations she has for you as someone who's living in Bellingham or living in the surrounding area. And maybe she'll find some gems that you don't know about and you can explore those. So I want you to welcome with me Dr. Caroline Hernandez to today's episode of the Hey Bellingham podcast. Hey there, Dr. Hernandez. Welcome to today's episode of the Hey Bellingham podcast. We're excited to have you here. Thanks for coming.
Hi, thank you for having me. I'm very excited.
So can you tell the listeners about how you got into chiropractic care in the first place? What was the inspirational moment or experience that you had that said, this is my path, I need to pursue this?
So I was actually in the military for 4 years as a military police. And when my 4 years came up and I was like, I don't really want to do this for the rest of my life. I mean, I love it, but it's not like a passion. So I got out and I was looking for things to do. And when I was in Texas, I was looking into different colleges to kind of start a career. And I stumbled upon Parker Chiropractic. And I went to an orientation for them, and they just talked about all the different ways that they can help the body, that they can help people, healing their bodies from like the inside out. And it was just kind of like this like light bulb moment of like, oh my gosh, this is my calling. This is what I need to do. I'd seen a chiropractor when I was younger, as like a child, but I never really thought about it much as an adult. And it wasn't until like I got back into chiropractic and I was like, oh my gosh, like, why did I ever stop? Like, how can I help like spread this to other people? How can I help like the rest of my community? So it was just really like a very big like light bulb moment for me.
That's awesome. So when you say inside out, that jumped out to me because for some people, that's like, what is that? Healing from the inside out? Well, that's kind of weird, or maybe it's not weird. They're intrigued, but either way, can you explain a little bit of
Yeah.
what that means?
So everyone's body has, we call it an innate ability. So it's like this presence inside of us. It's the ability for the brain to communicate down into the body through the nervous system, through every single nerve. And that goes to every organ, that goes to every muscle, that goes to every sensation that you feel, good or bad. Now, when we have these subluxations, that causes, the brain and the body to not communicate properly. So as chiropractors, we deliver an adjustment and that helps remove that interference so that brain and body can communicate. So it gives the body its ability to actually heal itself because it can communicate better by sending those transmission signals from the brain down to the rest of the body and vice versa.
So it's almost like there's a kink in the road and you straighten out the road so the signal can get through easier.
Exactly.
Okay. Yeah.
Straightening that road out.
Right. There's some crookedness in me right now, I'll tell you that much.
Oh no.
Up here, and I think it's from the exercise that I do, and that actually reminds me. So I do some CrossFit stuff, and I have a chiropractor friend that I've gone to, and he's kind of against the CrossFit world because of the way that it goes for certain people. Why do you think there's a resistance to that for chiropractors, or is that even something that you agree with?
Honestly, I think if like an exercise is done properly and if the body is properly aligned and it's properly maintained, then you're less likely to have those injuries. And I think a lot of times when people aren't, taking care of their bodies as they should be, yeah, they're working out and they're trying to eat healthy, but there's still those kinks within the system or those subluxations, and that will cause a person to be more prone to having an injury, especially if you're doing something that's like high intensity, high velocity, like a lot of CrossFit is. It just kind of sets you up to have more injuries. And I think that's why a lot of chiropractors or maybe even medical professionals in general are kind of against it. But I feel like if you're maintaining your body as you should, you're going to be less likely to have those type of injuries.
Right. And it's almost like if you, before you do some significant exercise endeavor, like a
Hmm.
marathon or some severe powerlifting type stuff or
Yeah.
whatever, that, well, might as well just go to a chiropractor first, make sure that you're lined up and aligned and everything. And then when you're
Hmm.
doing the proper techniques and the exercise, then everything's already lined
Hmm.
up and then you're not hurting yourself. What are your thoughts on that approach?
Yeah. And the main thing is, making sure, like we said, like getting in proper alignment. And it's not something that just like happens overnight, like one or two
Right.
adjustments. Like it is a process. It's definitely a long-term process as well, because it's something that you have to maintain, just like brushing your teeth. So you don't like go to your dentist and, not brush your teeth in between visits, or his visits, right? Or her visits. But you want to maintain that in between. And that's kind of what we need to do with chiropractic, is making sure that we're maintaining to be able to prevent those type of injuries. A lot of times people just go to chiropractors when they're just feeling something. They're feeling any discomfort or feeling tight, or, something is, as they like to say, like out of alignment or out of place. Um, where truly they don't know, because they can only feel 10% in their body. Out of their whole nervous system, you can only feel 10%.
Hmm.
So that leaves a whole 90% that's functioning, that they don't know how it's actually functioning. So that's what we assess in our office to make sure that, okay, how is the rest of that 90% doing? So we check the muscles, we check the organs. And of course, we are concerned with how you're feeling, but you can only feel 10%, and it's subjective. So your 2 out of 10 is someone's 10 out of 10. We can't measure that.
Hmm. Can you talk a little bit more about that 90%? I think that's really a fascinating statistic, and it's I imagine for a lot of people it's hard to access and understand
Hmm.
the other 90% is doing.
Yeah, and that's because that other 90% has no feeling. So you have your nerves that control your organs. We call those autonomic nerves. Kind of sounds like the word automatic. That's what controls, like I said, organs and cells and tissues that are keeping you alive, that you don't have to think about. So, like your heart, lungs, digestion, right? All these different organs, those don't have a sensory. So you can't just sit there and be like, it's feeling funny today. I mean, you probably could, because it's beating funny, like a heart, for example, but you can't judge it as you would pain. And same thing with muscles. So you have the motor nerves, which is the other 45%. If you split it up, the motor nerves control muscle. That brain has a protective mechanism to get really tight around nerves when there's any type of like irritation upon that nerve. And that's why things tend to get like tight, and things tend to be compensating from side to side, because you have the same muscle on each side of your body. But if you have a misalignment and it's pushing on one side more than another, then it's going to cause tightening, or it's going to cause some type of irritation in that muscle. So that's the difference between like the 90% and the 10%. So that's why we measure it,
Right.
to see how it's functioning.
Yeah, when you think about the scope of chiropractic care, can you discuss a little bit
Mm-hmm.
what is the scope? Because I've had some really cool things happen in while I've been under
Mm-hmm.
chiropractic care. So what is your scope? And if you could give us some sort of a story of helping a patient. I know you can't share names, but if you
No.
could give us a story also, that'd be great.
Yeah, so our scope of practice, it really depends on what state you're in. Will determine how big or small your scope of practice is. So here in Washington, our scope of practice is, being able to work with the spine. We can do different therapeutic exercises and things like that. Some chiropractors will do electrical stimulation, depending on your scope of practice, or how your practice functions, heat, ice, things like that. But solely, like in my practice, what we do is we work strictly like with the spine, with extremities, to help the body remove those interferences. Um, I've had people in my office, in particular, a couple that was trying to conceive, and they've been trying for years and years and years. And she became a patient and had, disclosed that to me, that, like, one of the things that we were trying to do is we're trying to, have a baby. I was like, great, like, let's go ahead and do an assessment on you. So we did different like orthopedic testing on her, got her started under care, took some x-rays on her, saw the misalignments that needed to be corrected. And within, I want to say within like 3 months, like her and her husband were able to conceive. So it was so fun. And now she's had her baby comes here. So it's just, it's all walks of life really for chiropractic. So it's pretty
Yeah.
amazing.
And I know you're not going to directly say it, but I will. I think there is a correlation between the work that you did and the fact that they were then able to get pregnant, just because
Yeah.
of there's just probably so much resistance in her body, and there was stress on that 90% that you were referring to earlier.
Mm-hmm.
And all of a sudden it was gone, maybe not 100% gone, and over the course
Yeah.
of time, it was gone.
Mm-hmm.
And then
Reducing that interference.
okay,
Yeah.
that's the right way to say it. And then
Mm-hmm.
now the body is receptive because it's more in alignment. And you say that alignment, and I think when you say it, I know that we're referring to something bigger than the picture of just bones being aligned. We're referring to the whole system being better aligned as a result of the work you guys do.
Everything is connected. Everything in our body is connected. Everything starts in the brain and then comes down through that nervous system. So that's why it's so important to make sure that the brain and the body are communicating, and there's no little speed bumps, I like to call them, in the
Yeah.
way, little interferences or subluxations. And that's the really big important thing, is making sure that things can communicate. When our bodies are able to, then we're functioning at our optimal state.
Right, right. So there's people really love the cracks and the pops, right? There's
Yeah.
there's the videos online. There's
Yeah.
the stuff where they literally put it in a place so that you can hear the crack as loud as possible. What is misleading about that?
So we call those cavitations, and it's basically different gases being released from a joint when you open up the joint enough. So with an adjustment, a lot of times we are opening up that joint just enough and gas is released. But not every single time that gas is going to be released. I mean, it can fill back up within 15 to 30, 45 minutes or so, depending on the area. So the crack is not necessarily the most important part. Yes, it's satisfying. Everybody likes it, but the important thing is making sure that the adjustment is delivered appropriately.
Yeah, when you think about your approach, your personal approach to chiropractic care, what do you enjoy most doing with your patients?
As far as like adjustment wise or goal
Yeah,
wise?
just your techniques, your approach, and what is it that you would say maybe you specialize in or you really enjoy the most?
So I treat full spine on my patients. So because like we said, everything is connected. They may come in with an area that's, more uncomfortable than another, or maybe they're just coming in for wellness reasons, right? So I will address the entire spine to make sure that their body can function at its optimal state. And just making sure that each adjustment is individualized to the person, because we take x-rays on all of our patients. So that way we can ensure that I am adjusting them without a doubt in my mind the best way for their body.
Yeah, that is, I mean, it's lovely to have that. Okay, this is how it started, and this is how it ended. Because I imagine you do before and after with it.
Yes. I do take x-rays, to be able to track how the spine is moving structurally,
Yeah,
because they're going to feel great after, the first handful of visits, because like we said, pain is only 10%. So once you remove tension or irritation off of a nerve, it's going to feel better. But I really focus on the structure of the spine. I focus to see how can we change that? How can we realign it? And also to make sure that we're going to be preventative for like arthritic change, because a lot of people don't realize that when a joint doesn't move, that's when arthritis can start to develop in the spine.
yeah. So if my wrist is hurting, but then you're focused on the spine, why is that still important to be focused on the spine, even though my wrist is hurting, for example?
So every nerve, like we've said, comes down from the neck down into the body. So sometimes if it is an issue in the arm or in the hand, it could be coming from the neck itself. But I do assess like extremities, meaning arms and legs and joints within the body outside of the spine. So if we need to, if it's not responding from just a spinal adjustment, then we'll go to the actual source and assess it there too.
Yeah, I find that fascinating that someone can adjust, you can adjust my spine, and then my knee is better.
Yep.
It's like, but we didn't even talk about that. But my knee is better. That's pretty cool. What would you say to someone that is experiencing, for example, knee pain and the doctor, and I'm not here to badmouth doctors or surgeons or
Nope.
anything like that.
Mm-mm.
That's not the point of
There's
what I'm
always a time and place. Yeah.
right. But let's just say the doctor's recommending that knee surgery and they're like, yeah, I kind of want to do it, or back surgery. What are your
Mhm.
thoughts on how to give chiropractic care a chance before someone pursues maybe quote an extreme approach?
Mhm. Great question. My kind of philosophy is always going from least invasive to invasive. So I would always start with a set of x-rays so I can see what is the alignment of the spine, what is the alignment of the pelvis, because it could be one hip is higher than the other, and that's causing a compensation throughout the rest of the body, down into the legs, even down into the feet, down into the ankles. One thing that we do, other than adjusting just that pelvis area, because it could rotate from side to side or be misaligned, we also do orthotics in our office, which could have like a heel lift to help
Mm,
retrain those muscles to go back to where they need to be to hold that pelvis in position as we're working it. So that is a direct correlation to that. A lot of times, once we start fixing the lower back and fixing the pelvis, knee pain, ankle pain, leg
right.
pains start to dissipate.
Right. Uh, you have a 3-year-old, if I remember correctly, from
I
what you shared.
do.
What are your thoughts on treating, infants and up in adolescence?
It is extremely important because starting off life, whether it doesn't matter how you're born, you more than likely are starting off life with some sort of subluxation. And when I say that, I mean babies are either pushed out, pulled out, however the method. And a lot of times that can cause misalignments in the upper cervical, like in the upper spine. And so starting off life subluxated, it's already kind of, not starting life off on a great foot. So letting our littles get adjusted and having them properly assessed so we can make sure that we're removing those interferences just lets them grow optimally, helps prevent any like types of like scoliosis that could be acquired. Little kids are in sports. I don't know about you, but they fall a lot, like
Right.
traumatically. Little kids fall traumatically like 4,000 times by the time they're like, I think it's like 14.
Oh,
So it's
wow.
a lot of times. I like to say Miguel's probably going to be a couple more because he's a rough kid, but that's why I just keep him adjusted. I keep him on a regular treatment for him. I do it either every other week or every 3 to 4 weeks. So I make sure that he's adjusted no further than once a month.
Yeah, and is there any danger in doing adjustments frequently?
No, as far as frequently, it depends on how frequently your patient needs to be adjusted. And
Mhm.
that's why we do the exams and that's why we do our x-rays on, I like to x-ray from around age like 7, 8 and up, just because the body grows so rapidly up until then. But when you have a set of x-rays, it's kind of like a blueprint and it tells you how to adjust your patients. We call it a little recipe, how to adjust somebody, because each person is different. And so that helps us make sure that there's no way that we're going to cause any harm to them.
Can you tell us a little bit about just some other stories of people coming to you and having some struggles with their health? I'll tell a quick personal story
Mhm.
as you think about it. I
Mhm.
I had a food allergy that I was allergic to dairy, wheat, and corn, and a chiropractor did some muscle testing on me, and maybe when you're talking, you can explain a little bit of what that is
Mhm.
and what it means. But he did some muscle testing on me and discovered the allergies. I had no clue. I came into him and I had about at that time probably 8 years of chronic pain that prevented me from getting up off the floor very easily. I couldn't really lift my arms above my head. I
Mhm.
had feet pain, I had hip pain, I had lat pain, it was ugly. And then he discovered the allergies through that method, made some adjustments, helped me out. And then there's some other things happened in my life to help me ultimately get rid of the allergies completely, which is its own miraculous story that is for another time. But it was his discovering of those allergies he changed my life. Like fundamentally, he changed my life and absolutely huge for me. So when you think about some of the things that you've done with patients and how it's impacted their lives, can you share a
Mhm.
couple stories about that?
Yeah, I mean, there's so many. It's incredible. Being in this field is absolutely amazing to be able to help people with these type of issues. But I've had people, like we talked about, people not being able to conceive. I've had people whose they brought me their little ones because they've been having like colic, or they've had like chronic ear infections, and they just needed proper alignment, or they just needed an adjustment, I should say, and helped alleviate that. And it's not something that kids grow out of necessarily. They have a misalignment, and that's what causes that. I had someone recently bring me their son, 8-month old, who she had taken to her medical doctor repeatedly. Like she said, almost once a week for the past like month or month and a half. And they got to the point they're like, nothing is wrong with him. He's going to grow out of it. Give him gas drops. Give him the treatments that they were giving. She had done all the things that she had recommended. She brought him to me, and I did an assessment on him. He had some misalignments within his mid back area, as well as in his lower back and the pelvis, and the upper cervical. So a couple in each area, I should
Wow.
say. But so he definitely needed some adjusting. And so after 3 visits, I'd asked her, okay, how's he doing? Is he still like, cause he would have these like fits almost, where he was just like unconsolable for like maybe like an hour. And that's really hard as a mom, like you're trying to do everything you can and you can't, and you're doing what the doctors are telling you and it's not helping. And she said he hasn't had a single one. That was only after 3 adjustments. And I was seeing him twice a week. So we were in his 2nd week, and he had already stopped having those hour-long fits. He was going to the bathroom. He was having bowel movements regularly. He was sleeping harder through the night, and being restful and not so startled at night by like sounds and things like that. And so she was just beyond grateful that it was something as, I don't want to say simple because it's not simple at all, but something as an adjustment was able to help her in 3 visits versus she had been trying for like a month and a half. I've had people that have come to me with like chronic migraines. Like I'm talking like multiple migraines a week for years. And after like a month or so of, being seen maybe 3 times a week, given different exercises and things for them to do at home, because it's teamwork,
Yep.
what they do and what we do is we work together. Come back to me and say, hey, I haven't had a migraine in over a week. And it's been years since I have been able to say that.
Wow.
Just from being able to deliver these type of adjustments for people and change their lives. And it's really, really amazing. I mean, the list goes on
Right.
as far as what people
I think
come to us with. Yeah.
I think you and I both have in my world of coaching. I have stories like that, just these dramatic, beautiful, wonderful changes. And it is, but it's not the only fuel that keeps me going, but it's part of it. It's a
Exactly.
wonderful additive. Let's call it a great fuel
Exactly.
additive, because you have the normal experiences, which are most of the time, which matter and they're valuable. And then you get that little additive in there. You're like, that's a cool one. That's a great
that's
one.
amazing.
Yeah.
Like, this is really cool.
Yeah.
So it's kind of like those cases, or those patients who are a little more difficult as far as like what they have going on, and then being able to help them with that. But it's still amazing to be able to help people like not have any discomfort or prevent their arthritis from worsening. You don't feel that arthritis necessarily. So being able to provide them with something as adjusting to help prevent that from, worsening within their spine later down the line could be a preventative measure.
Right.
That's what chiropractic is we're preventative.
Right.
People come to us when they're hurting, but we're more than preventative.
Yeah. Yeah. I really like that. I want to ask you or make a comment, and then maybe we can adjust a little bit towards your experiences living in Whatcom. My daughter and I my youngest, she's 7 now. Yes, she's 7. We were not lining up. Okay, we'll just say we were not lining up emotionally, and we have the same personality, and so that's part of the problem. And it's on me. I'm the dad, right? So it's on me if we're not lining up. But anyway, she had a temper, and she got in trouble a bit at school because she had a temper and she wasn't listening well. And in retrospect, I wonder if an adjustment could have been helpful for her, because she's growing up, she's pretty active, she's pretty aggressive, and we're a pretty active family. She's doing activities, but then we also do hiking, and they're running around, et cetera, et cetera. And she's fallen just a few times also. So, I wonder if that would have been an approach to take to help her, because she can focus pretty well in school, but then things kind of fall out. So there's probably a lot of kids out there that they're like ADD or whatever, when maybe they're just out of whack. And
yes,
if they could
agree.
Yeah, if they could just get back in balance, then their mind will be in a better place and they won't be dealing with that 90% pain that that they can't really identify.
Yeah. So we have what are called mechanoreceptors in the body. These are the signals that send to the brain where we are in space and time and how things are functioning. Little kids, they're not developed in them until they're at least like 2021.
Oh, wow.
So yeah, so that 90%, right, is always functioning. It's never not functioning. It's always sending those signals up to the brain. You have, I think it's for every 40 or every you have signals that come up to the brain and signals that come down to the brain. So you have 40 signals that come up for one that comes down. So does that make sense?
Wow.
Yeah, so it's super important that those signals are being sent properly because it can cause things like, emotional differences or, I always joke with my son. I say, come over here. I'm going to adjust the attitude. I'm going to adjust your attitude. So I do tell him that. And he's like, you adjusted. I'm like, well, it's your time for adjustment anyways. But it does make a difference in him. And in other little kids that I've adjusted here in the office, seeing them and how it affects their, not necessarily, I don't want to say their personality because their personality stays the same, but it helps them
Right.
function better,
Right.
a lot better. It helps reduce those like bursts out.
Right. And it's like, if you think about it, if you're out of balance
Mm-hmm.
in a very clear area of life, like if your work is out of balance with your life, then it
Mm-hmm.
impacts everything, right? Your
Yes.
things are not going to be right. And it's the same thing in internally for our bodies, the same
Mm-hmm.
thing's going to be happening. And it's
Yes.
it's trusting and tuning into that. I think sometimes we intuitively know something's a little bit off, and
Mm-hmm.
it's like, okay, now's the time to do something about it. And sometimes
Yeah.
chiropractic care is the right choice. Sometimes it's
Mm-hmm.
diet, sometimes it's exercise,
Yeah.
whatever.
It's a combination of things.
Right.
It's a lifestyle, right? So
Yeah.
you have like your chiropractic adjustments, you have how you're moving your body, you have how you're thinking. We have three, we have thoughts, toxins, and traumas. Those are the three things in the body that can cause or that happen to the body that can cause subluxation. So we have a psychosomatic effect, brain body effect. So
Yeah.
stress, things like that cause subluxations, things don't function correctly. Diet, same thing. And the same thing with traumas. Like we talked about, you fall down 4,000 times by the time you're 14, you're going to have some problems.
Right. Right. Can you say those three again? I think it's important. I want to hear them again, but I also think it's important that the listeners hear those three again.
Yeah. So we have thoughts, toxins, and trauma. So thoughts, those are things like stress, anxiety, depression, things like that. It's how the body and the brain are acting upon each other. Call it a psychosomatic effect. And then we also have toxins, so things that we're putting into our bodies or things that are in our environment that are affecting us. And then we also have trauma, so getting hurt, getting in car accidents, falling down, things like that. A lot of people don't really think about the thoughts
Right.
as much as they do with like toxins and traumas, but it does have a huge effect on anxiety and depression. Little story about myself personally. After I had Miguel, I had a pretty severe amount of anxiety and depression that I've never experienced like that before. It was a very rough time. But when I was able to, with Dr. Sheen, the other doctor that I work with, we would come in and he would adjust me and he would adjust the areas that controlled the rest and digest part of our nervous system. And that would really help bring me out of that like fight or flight and help calm me down so I was able to function like an adult again. Like it was wild. So we would do that multiple times a week and we would kind of check in with each other. Hey, how are you doing today? Like what level on this like anxiety scale that we made up, like, are you at? And I'm like, not a good day. He's like, all right, let's go adjust you. And then within 15 minutes, I would start calming back down.
Wow.
And so it was able to help like reset my nervous system.
Yeah. Yeah. It's amazing the power of our thoughts. I mean, I deal with a lot of the thoughts of my clients because
Yes.
I call it head trash, and that head trash is stinky and smelly and it mucks things up, and then that messes up all kinds of things in their personal lives and their professional lives. And if you can get rid of the head trash, then all of a sudden things are very, very different, and what you think you're capable of changes, etc. So that combination of the physical adjustment with the mental adjustment is very powerful.
Yeah, absolutely.
You mentioned earlier lifestyle and just how your lifestyle impacts your health, your body, etc. But I'm curious about your lifestyle and what your experiences have been in Bellingham and in Ferndale and beyond. And what would you say are some of your favorite things about Whatcom County?
So Whatcom County. So I live in Ferndale. It's a smaller community. It is growing, which is amazing. I've only been here for about 4 years, 5 years about. So coming up from Texas and Southern California is where I'm from. But being in Whatcom County, it's so nice that it's just like a slower pace, small town vibe. Like everybody knows everybody. Everybody is like pretty willing to like help each other. Whereas like in a big city, like nobody really does that. Everybody's too hustle bustle, has to go where they're going, right? And they could care less about anybody else. But in Ferndale and in certain areas in Bellingham, it's definitely um, really nice to be around people that you know that are like-minded.
For sure. I had this, we moved to Linden, that's going to be 3 years ago. Is
Mhm.
that right? I think that's right. Anyway, we moved to Linden and I had this impression about this town. And it was a judgment that I placed on it for whatever reasons. And then after, 6 months, a year, 2 years, I'm like, I'm wrong. My negative impression was wrong. And it is what you're talking about. It's community, it's interactions, it's enjoyable. People are supporting each other, they know each other. Some of them have known each other for generations out in Linden
Yeah.
because I
Mhm.
West Ferndale might be a little bit like that too, but especially Linden, you got
Mhm.
these dairy farming and berry farming generations of families, and there's something about that. I grew up in a small town, so I'm a little bit attracted to that. But
Mm.
when it comes to Ferndale, I lived there with my wife for 6 years,
Mhm.
and it's the first house we bought when we moved here, and we had a good experience there as well.
Yeah.
We visited some restaurants and did some things in town and went to the parks and stuff like that. What are some of your favorite places in Ferndale?
I definitely love taking Miguel to Hovander. They have like their little animals there. They have like their little fragrance garden, and it's a great experience for us just to be able. We could be there pretty much all day long if you wanted, if I'd let them.
It's true, and it's big. It's big.
It's
There's
huge.
Yeah, and you can walk along the river. Have you
Mhm.
gone along the river so that you're kind of moving out of the park and there's a little trail that goes down actually to the river? Have you done that yet?
Yeah, we actually did that last summer. It was really fun.
Yeah, it's like the only sandy beach in all of Whatcom County.
Yeah, exactly. So we'll be visiting that many times.
Yeah, we used to when we lived, 4 minutes or whatever from Hovander, and
Mhm.
the kids were younger then, but we'd go there and skip rocks and build sand castles. So it was a lot of fun.
Fun. That's a lot of fun.
How about favorite restaurant in Ferndale or a restaurant you like to go to in Ferndale?
Um, we Well, where did we go recently? We went over to the Black Cat in Bellingham, and that was really good. We've
Yeah.
been to Anthony's down by the marina, and
Oh
that's
yeah.
also a really nice experience. That's where we usually will take like family and stuff like that. So pretty fun.
Awesome. Anything else that you would like to share with the audience before we go?
Um, I just wanted to say thank you to everyone for listening to us today. And if you or have any loved ones that would be interested in chiropractic care or getting started with chiropractic care, in our office, we're offering a free consultation and examination in our office. And it does, it saves you a good $200 to be able to see if chiropractic is a great start for you and for your family. If you guys are interested, just mention that you heard about us on Hey Bellingham.
Awesome. Yeah, well, audience, please do that. And please make sure to like this episode if you see it on social, to comment if you see it on social, to subscribe when you see it on Spotify or Apple Podcasts. And then just stop by. Check out Natural Way Chiropractic in Ferndale. Say hello to Dr. Hernandez. And I just want to thank you, Dr. Hernandez, for being on today's episode of the Hey Bellingham podcast.
Thank you so much for having me. It was really great.
Artists, owners, voices, bring it alive.